After a posterior spinal fusion, most patients stay in the hospital for a total of 3 days before returning home for a complete recovery. We want to make sure that you and your family feel prepared for going home. This video is designed to help you to understand how to safely mobilize patients who have undergone a posterior spinal fusion. When it comes to your posterior spinal fusion, the most important thing to remember is your spinal precautions. That's your BLT sandwich. That means no bending past 90 degrees, no lifting greater than 5 pounds, and no twisting at your trunk. Examples of those is bending at your hips like this, which is the same as bending down to touch your toes like this. No lifting greater than 5 pounds is not lifting a backpack or lifting a trash bag. Twisting means that you want to keep your shoulder and your hip in alignment. If you're forward like this and rotating, that means you're twisting at your trunk, and that's breaking your spinal precautions. So try to keep your arm in a straight line. Now that we've talked about your spinal precautions, the next thing we're going to talk about is how to get your child into and out of bed safely. The first thing that you're going to want to do is have them log roll to the side of the bed. Log rolling, you put one hand on their shoulder and one hand on their hip, making sure that they don't twist at the spine. Ready? 1, 2, 3. The next thing you're going to do is help your child get into sitting. To do that, you'll gently drop their legs off the side of the bed, place one hand on their hip and one hand under their shoulder. The most important thing is really pushing down at this hip here and gently lifting up under their shoulder. Ready? 1, 2, 3. Now that your child is in sitting, you're going to want to ensure that they're not dizzy. Are you dizzy?
No.
If they're not dizzy, then it's safe to move forward. To help your child come into standing, you're going to want to make sure that their feet are firmly placed on the ground so that they don't break that 90-degree hip precaution. To help your child move forward, gently lean them to one side, place one hand behind their bottom, and help them to come forward, maintaining that shoulder and hip in alignment. Now that your child's feet are firmly placed on the ground, it's safe to move into standing. What you want to do is have your child place their hands on your shoulders, and you'll come in under their bottom here to help them stand up. You want to make sure that your child is not breaking that 90-degree hip precaution, and when they come forward, they don't lean forward. That's why your hands are here to help block from them leaning forward. Ready? 1, 2, 3. And now that your child isn't standing, we're going to want to help them get back into bed safely. The first thing that you're going to want to do is have your child place their hands on your shoulders, and you're going to place your hands at their bottom. The most important thing to remember is that you don't put your hands at their trunk or under their armpits to help them to sit back down, as this could cause you to slip and traction their spine and affect the surgical site. So you'll place one hand here, slowly lower so they don't plop and bend past that 90 degrees. And now that they're in sitting, you can help them safely scoot back the same way that we moved forward in bed. Lean, and this time you can come here and gently scoot back, maintaining that hip and shoulder in alignment. Lean, scoot. And now that your child is sitting safely, you're going to have one swift motion that you're going to assist them back into bed. With that, you're going to put one hand here and one hand under their knees, and you're going to scoop and gently come from the side and then onto your back. Ready? 1, 2, 3. And that is how you safely mobilize a patient getting out of and into bed after having a posterior spinal fusion. Always remember, BLT. No bending, no lifting, and no twisting. If you have any questions about anything that you've seen in this video, please ask your physical therapist.